But this is what we see in the medical world. When hateful patients that we dread, we're working with them, and they evoke negative feelings in us. Quite often, what we see first and foremost is sometimes the care provider, the clinician, becomes paralyzed. You know, maybe they begin by trying to help this patient too much, and that fails, and then they resort to maybe the bare minimum, and that just pours kerosene on the fire. So quite often there's a paralysis, if you will. Things kind of come to a stop. There's a malfunction in care delivered. And, you know, of course, things can always get worse, can't they? That's part of the lesson of our time on this planet. That's the lesson of life, that things can always get worse. So sometimes these negative feelings can go to the next step where the care provider, the clinician, may unconsciously punish the patient. I'm furious at you right now, so we're going to give you your medicine for pain a little later, not right now. You know, and I'm not saying that this is necessarily conscious. It's primarily unconscious. Sometimes it is conscious. There can be punishment. Usually it's in terms of not active punishment, but more passive withholding. Third bullet, you know, what's the famous quote by Bill Clinton? The worst wounds are the ones that are self-inflicted. The third bullet, you know, negative feelings that patients provoke in us, the provider, or us, the caregiver. Sometimes we leave the encounter saying, wow, I'm a bad doctor. I'm a bad caregiver. If I was only better, if I was only more noble, if I had thicker skin, if I didn't let this patient get to me, then I wouldn't be feeling the way I'm feeling. So we beat ourselves up. And I don't know about you, but when I beat myself up, I'm no good to anybody, including myself. And then the fourth bullet, and you'll see this more often than not in emergency situations. This is where things have gone wrong from second one, and they go from bad to worse, and worse to ballistic, worse to catastrophic. And you know, the typical picture is the emergency room doctor, you know, telling the patient that they're a crock and they don't deserve any treatment, and kind of resulting in bullet 5, get out of my emergency room, where the patient is now extruded. So what's the sum of this? The sum of this is the patient doesn't get the care that they deserve and that they need, and the caregiver suffers as well. So this is truly the double-edged sword if we don't pay attention to this and fix it.